Hi guys, I hope you're all doing well. This is going to be a different type of video, a more serious and sensitive, I guess you can say, topic. I'm going to touch on medical gaslighting, especially for women, and this is just based on my own personal experiences. This isn't to bash the NHS or to bash all doctors and nurses, because believe me, I have come across some amazing ones, ones that have taken great care of me, that have made me feel safe, that have gotten me better from, terrible medical emergencies. And I will be forever thankful to those who cared for me in, the utmost respect and graceful manner. But I'm going to touch on a certain situation that happened to me at Christmas time that changed my perspective of the NHS as a whole, and just totally shocked me actually. So basically, from the time my son was born 4 years ago, when he was around 6 or 8 months old, can't quite remember now, it was a long time ago, but around that age, I started to get tremendous lower back pain. We were in the midst of a global pandemic, actually the worst of it, and at the time they was advising everyone, obviously, don't go to the A&E unless it's life or death, or unless you got COVID. GPs stopped seeing people face to face, and 111, you couldn't even get through on the line because it was so jam-packed of people phoning in because they had COVID. So really I was just stuck at home with this excruciating pain that I'd never felt before, never had before, in my lower back. And then I was just treating that with myself with over-the-counter painkillers. I'm not going to go into the full story because, well, that would just take hours really, because it's just such a long complex, complicated story of misdiagnosis and various operations and treatments and all kinds of things I've had. But yeah, I just really want to touch on this particular situation. I've had several situations that haven't been very pleasant, let's just put it that way. But this particular one really got to me on a personal level, because it was a personal attack. And it was Christmas time, and it was Christmas Day, and I developed severe diarrhea, severe sickness, a very high fever. The sweat was just dripping off of my forehead continuously and running all down my body, but it was a cold sweat. It wasn't like a normal sweat, like you're getting hot and flustered. It was a cold sweat. And I actually stayed like that for a good few days before I went into the A&E on Christmas Day. I actually fell ill like before Christmas, and I was just getting more and more sick. But I thought, maybe I've eaten something a bit dodgy. I was putting it down to, whatever. Then when, the fever started to not go down with paracetamol and ibuprofen, I'm like, oh, okay. And the diarrhea was just, well, I couldn't even sip water. I was retaining nothing. And, well, the weight was within days, the weight was just falling off of me. It was just madness. So I went into the A&E on Christmas, and obviously I knew Christmas they're going to be busy, right? This was Christmas of like last year. So I expected them to be pretty busy, run off their feet, okay. When I got there, it was busy, busier than usual. I waited in total in A&E in that state for 6 hours. And they sent me, this was at Queen's Hospital in Romford, and they sent me to ESDEC, which is like another part of A&E that they have created, which is supposed to take the pressure off of the normal A&E. So they're sending people to ESDEC now that they believe are minor and not too serious. So I got sent to ESDEC. I already got seen after 6 hours in the normal A&E, and they just spoke to me and was like, oh, so what's wrong with you then? And I told them all my symptoms, and then they sent me straight to ESDEC. So I got to ESDEC and I waited a further 2 hours in ESDEC. So a total of 8 hours now I'm waiting. And the doctor called my name, and he was acting a little bit bombastic, I would say. Even when he called my name and he was like, follow me, and he was acting, a bit strange, but I thought, they're stressed and whatever, it's Christmas and who wants to work on Christmas, But I followed him anyway, and he took me into this room that was way out of ESDEC. He took me into this side room, this tiny little side room, and he closed the door, and he was like, so what can I do for you today, madam? So I explained everything, all of my terrible, nasty, horrible symptoms, and he could clearly see, anyone, you wouldn't even have to have been a medical professional to have seen just how poorly I was. I looked like a ghost. I looked like I was just going to drop at any minute. And I explained everything, and he said to me, because basically I was bleeding from my bottom. And he said to me, did you take pictures? And I said, well, no, I didn't think to take pictures, because obviously, like, I'm very, very poorly, and I'm not going to be carrying my phone into the bathroom with me and taking pictures, and I'm just rushing in, rushing out, and, it's just not something I would think of. So he said, because you didn't take pictures, I can't believe you. And I don't believe that you're telling me the truth. And I just looked at him in disbelief myself that he was saying this to me. It was almost like I was dreaming, like, this isn't real. Like, how could a doctor say that to a patient, first of all? The way he was looking at me, the tone of his voice was getting louder and louder. So I was sitting down and he was standing up. I was sitting on the bed, and he was at this point leaning kind of over me, getting closer and closer to my face. And he was like, you're mad. There's something wrong with you, woman. You're mad. You're crazy. Why would you come here and make up all these lies that you've got this and you've got that? Can't you see how many people are waiting out in A&E? Don't you think I'm stressed enough without you coming in and making up these lies? And he was just yelling at me all of this crap, quite frankly, just absolute crap. And because I was so weak and so poorly and so desperate to be helped, I just burst out crying, uncontrollably sobbing. And like, I'm thinking as I'm uncontrollably sobbing, Alexandra, pull it together. Come on. Don't sob. You have to stand up for yourself. You have to defend yourself. If you're sobbing, it's going to make you look more weak, and they're going to take advantage of you more. And I said to him, because I saw there was another doctor out on the ESDEC reception part, the desk part, and I said, get that doctor now. I want that doctor. And he's like, no, you're seeing me and that's it. You have to leave. There's nothing wrong with you. I said, you've done no tests. You've done nothing. Get that doctor in now. I want to see him. So he went and got that doctor, and he was yelling at the top of his voice in front of all the other patients that were sitting on the armchairs having their drips, yelling about me, that I'm a mad woman, that I'm a liar, that I'm pretending I'm bleeding from my backside, that I'm doing it for attention. Bearing in mind, he had given me no blood tests. This was just from me telling him my symptoms, and he just blew. So the other doctor comes in, and I'm still crying, couldn't even control it. I don't know what came, well, I do know what came over me. I was terribly weak, terribly ill, and in shock, and quite traumatized actually, that this man, this idiot, was standing over me in an aggressive, intimidating manner, who was meant to be a doctor, and was insulting the living daylights out of me and yelling at me, insulting me, calling me mad and all kinds of things. And I was just inconsolable. And the other doctor came in, and he said to me, don't cry. And he was very compassionate. He had a compassionate tone. And he said, don't cry. Just explain everything to me from start to finish. So I explained everything. And he said to me, looking at you, I can see from your eyes and how dry your lips and your mouth are, that you are clinically very dehydrated. So first of all, I'm going to put you on 2 drips, one sugar drip and one normal drip. And we're going to get bloods done, and we're going to see your infection markers and see if you've got an infection going on because you've got high fever. So he did all of that, and surprise, surprise, my infection markers were sky high. My sugar levels were dangerously low because I hadn't been able to eat or drink at that point for nearly a week, because I delayed going to the A&E because I thought I could deal with it at home. So he got me, he got me hooked up to the drip and the sugar drip and everything. He gave me a course of antibiotics as well, because they didn't really know why my infection markers were raised. They didn't know, well, he didn't know what was wrong with me, but he couldn't give me a diagnosis, but at least he gave me some compassion, right? And he apologized for his colleague, and the medical gaslighting in that situation, the fact that, well, not even medical gaslighting, but abuse, really, the fact that that doctor didn't even spend 10 minutes or 5 minutes to arrange, however long it takes them to arrange tests to be done, to give me the benefit of the doubt. Not only that, but like the other doctor said, you could clearly see just by looking at me how dangerously poorly I was, and how if they would have left me, if I had have been, I don't know, maybe 18 or 19 years old and not had other previous experiences of medical gaslighting and kind of knew that sometimes you can get into these situations, if I hadn't have pushed to see that other doctor, God knows what would have happened to me. So, like I said, it's not the first time I've had this done. I mean, this was the most traumatic experience I've had. But I've had other instances where I've had doctors pull faces at me, tell me they didn't believe me, etc., etc. But that was to the point where it was verbal abuse. He was over me, he was intimidating me. And I just want to talk about it, because I'm sure it's happened to thousands of other people, and I'm sure that, like me, I went back when I was better a few weeks later, and I did report it to one of the other nurses, and I was going to see it through. But I know that that doctor isn't going to lose his job just from one report. I don't know if other people have ever reported it. I'm sure that he hasn't just done that to me because it came too quickly, it came too naturally for him. I mean, he flew off the handle within a few seconds. So it looks like to me that he has done that many times to other people. And I don't know if they've complained or not, but I mean, clearly he's still working. I mean, he was a senior doctor. So I just don't understand how these people can keep their jobs. Speak to patients like that. And like I said, if I hadn't have been unfortunately experienced in having been medically gaslit before, I would have probably have felt so intimidated and so like, oh gosh, you know, I'm bothering him, I bothered him, it's Christmas, I put too much pressure on him, that's why he flew off, or it's all my fault. I would have gone home that night and God knows what would have happened to me. And I just feel like this happens a lot and people are too scared to come forward and to talk about it, too embarrassed, because, you know, we think of all these like, oh, COVID happened and they're under pressure. And I got sick right in the midst of a pandemic. And at that point I was feeling sorry for them. They were also dying as well. The medical staff were dying. Obviously, they were catching the COVID from the patients, and everyone was feeling so sorry for them. And, you know, we were calling them national heroes. And no doubt, obviously, they were saving thousands of people's lives. And no doubt I've came across the most wonderful doctors and nurses. But I have come across some just ones that just should not be practicing medicine. That's the nicest way I can put it. I've blatantly had doctors pull faces at me, told me they don't believe me. I've had symptoms of chronic pain and severe diarrhea on and off, vomiting on and off. I had another, a few weeks ago, I had another flare-up of it and I had to go to the hospital. Luckily, I don't go to Queen's anymore. I went to another hospital and they treated me properly and got me better. It turns out I have Crohn's disease, and now I'm kind of, unless I'm in a situation where I'm like, okay, I can't deal with this at home. It gets too severe, like I'm vomiting, I can't keep anything down, back or front, you know, and it's coming out both ends and I'm dehydrated and I can't eat and I've got a fever or whatever, then I go to the hospital. But for the most part, I've had so many bad experiences that I deal with it at home. I've changed my diet. I've cut out certain foods. I deal with the pain with over-the-counter paracetamol, ibuprofen. I still haven't got a gastroenterologist, which I was meant to get to put me on a treatment plan. I'm still not really officially diagnosed, because on the CT scan that they did, it showed that I had quite severe inflammation within the rectum, and they were like, I'm 90% sure you have Crohn's disease. And then when they did the colonoscopy, it was clear. So I'm currently on a waiting list on the NHS for a gastroenterologist who, you know, is supposed to put me on this treatment plan, probably steroids, which you mostly get put on when you have, you know, Crohn's, when it's really bad. So at the moment, every couple of weeks, I have these really bad, I call them flares. or they are Crohn's flares, where, like I said, continuous vomiting, severe diarrhea, can't keep anything down, can't eat, can't drink, get severely dehydrated in the end, high fever, sweating, all the rest of it, and I have to go into hospital. Because it's not officially written down on paper that I have Crohn's disease, it's only shown on one scan. And they've put me on the waiting list for a gastroenterologist. I'm still getting medically gaslit, because even the last time I went to the hospital, they're like, oh, well, we can't for sure say it's Crohn's. You have all the Crohn's symptoms and you have inflammation there on the CT scan, but I mean, and I'm like, you don't just get these symptoms. And I've had these, like I said, for 4 years now. I've suffered all of this for 4 years, and I've been through so many misdiagnoses of, well, they just put it all on women's issues. You've got this, you've got that, you've got a UTI infection, you've got this, God knows what it's, I mean, it's not even UTI symptoms, but they put it down to all kinds of different things, put me on this antibiotic and that antibiotic, and obviously nothing, because antibiotics doesn't treat Crohn's flare-ups. You need steroids, and you need, in the worst case scenario, immune suppressants, and then if that doesn't work, then they give you surgery, and they give you a bag that you poo in. They remove your bowels when it gets to the point where nothing at all is helping. And obviously I'm not nowhere near at that point, but I'm at the point where currently my 4-year-old actually eats more food than me a day. Like I said, I've had to cut out a lot of things from my diet. I'm not on any active treatment because they're only 90% sure I have Crohn's. The other 10%, well, the other 10% means I don't get any treatment, right? And whenever I go to the hospital and I have my flare-ups, I still get the faces pulled at me and the disbelief, and I just feel like doctors, specialists, nurses, it's their job to believe the patient, because I don't think there are many people, I'm sure some do maybe for attention, but I don't think there's many people that have kids waiting for them at home that's going to spend 6 to 8 hours in the A&E just for fun. I'd rather spend that time with my family. I'd rather be at home with my son and my husband. I'd rather be, I don't know, out somewhere taking my boy to the zoo or whatever, doing things that parents do with their kids, but I can't because I'm too ill and I'm at A&E. So I'm not doing any of this for fun. I'm not doing it for attention, and I don't suppose any person in my situation would be. And I think they need to listen to the patient, because we know our bodies more than anyone in the world does. I know my body, like I'm one of these people that's really in touch with my body. Like when there is anything, even the slightest thing wrong, I know and I can tell. And I always know days before the flare-up kind of really gets me. I'm like to my husband, I'm going to have a flare-up, and I always end up having a flare-up because I get these subtle symptoms of the pain gets more, and whenever I eat anything at all, the bloating is very severe, and I start to get constipation one minute, then diarrhea the next, and it's all up and down, and then I get the really severe flares. So I always know there's always a lead up to it, and it needs to be taken seriously. It needs to be I don't think stomach issues are actually taken seriously enough. Like, even IBS can be, you know, a problem for people, and it can affect your life. Crohn's disease affects your life. There's just, I think, yeah. I just wanted to come on and just put the message out there that let's advocate for ourselves. Don't let anyone gaslight you. Don't let anyone send you home when you know that you are seriously ill, or when you know your loved one is seriously ill. You say, no, I want treatment, and you know, I'm that's our right. We go to the hospital to get treated, to get better. We don't get, you know, there's no point sending us home to get more sick, because we have to, if we get more sick, we have to use more of their resources anyway, so what's the point, right? And yeah, just over the years I've learned to not take no as an answer, basically. I mean, like, I've been sent home so many times, and I always stand my ground, and I'm like, no, I need to be treated. I'm poorly, and I can't do this at home, because I never go in, oh, as soon as I get pain, you know, or my pain's getting a little bit worse, I'm going to go in. It takes, like I said, predominantly I deal with it at home, and it has to get really bad before I go to the A&E. And when I go to the A&E, then you realise that, okay, it's getting, like, she can't deal with this. And it's always the point, like where I said, where you can physically see that I am poorly. So I would expect then I would expect them to give me the benefit of the doubt, to run tests, to get to the bottom of it, you know, to treat me. So advocate for yourself, guys. And yeah, medical gaslighting is a real thing. It happens to thousands of people, and don't let anybody tell you, oh, it's ladies' issues, it's because of ladies' issues, it's because of this, it's because of that. Doctors love doing that to us women. That's what I've experienced. Like I said, I've had so many things. Like, I've had everything apparently by in the kitchen sink. I've got this, I've got that. And they'll just pile all this stuff onto you, and they'll give you all of this stuff, different painkillers, different antibiotics, when really what they need to do are scans, CT scans, MRI scans, ultrasound scans. These are the real things that detect if there is anything going on seriously in your body. And yeah, my journey in this whole, I don't like saying journey, it sounds so corny, but this whole process, it's already been 4 years, and it's still continuing. Like I said, I'm on this waiting list, NHS waiting lists go on sometimes for years. I mean, I've been waiting now for this gastroenterologist for 7 months already. And, you know, I need some kind of treatment. I mean, I need to start being able to eat normally again. I need a proper medical diet plan, most probably. Yeah, there's so many things that I need help with, that I'm just simply not getting. And I'm not gonna stop fighting for, you know, advocating for myself, because it's my body, it's my life, you know. I have a son that I need to take care of, that I need to be healthy for. And yeah, it's just it sucks, guys. But I just wanted to come on here and chat about that. So yeah, comment down below if you've experienced any medical gaslighting, if you are going through something similar. I'd really love to know and to hear. because yeah, I really think that it needs to be spoken about more, and there needs to be more Crohn's awareness. It people say it's so many different things that it's not, when really it's Crohn's, and there needs to be more awareness on Crohn's disease because it's not pleasant. It really isn't. It's life-changing, actually. It's life-changing and it's lifelong. There's no cure for it. It's not going to magically disappear. Even if they put you on treatment, you know. So, anyway, hopefully the next video won't be so deep. And yeah, I'll catch you in the next one. Have a good night. Take care, everyone.